Greetings and welcome to our latest edition of Smart Counsel. I'm Suzanne Sayward, a partner at the Dedham, Massachusetts law firm of Samuel Sayward and Baylor. For those of you who know us, we concentrate our practice in the areas of estate planning, estate and trust administration, elder law, and probate. Some of you have attended our Smart Counsel presentations over the last few years when we would have them in the office with some wine and cheese, and it was all quite lovely. But now that we're all hanging out at home or by ourselves, we want to continue our tradition of our presentations as we know our clients and friends enjoyed them. And so for now, we're doing them via a webinar. And we'd love to have your feedback if you want us to continue to do this and if you have other topics that you would like to hear about. So tonight we have with us Camille Barron. Say hello, Camille.
Hello, thank you for having us.
Of course, and Diane Savastano. Both Camille and Diane are from Healthassist, and they're going to talk to us about important tips and tricks and information to know about that very complicated program called Medicare. So Camille is going to introduce, give a more robust introduction of Diane, but Healthassist is an organization that helps people really navigate the complexities of the healthcare system. And for anybody who's about to sign up for Medicare, you know it's a very daunting prospect. So Camille and Diane provide education, enrollment in Medicare. They help you sort out what's the best program for you. And they'll talk a little bit about how they do this and the things to consider. So I'm going to turn off my video and turn over the program to Camille and Diane, and I'll come back at the end. If you have questions, you can post those questions by clicking on the Q&A at the bottom of your Zoom screen, and you can type your question in there. Camille and Diane will be sharing their screen with some PowerPoint presentations. And if you're having a hard time seeing things clearly, you might click on the top and make sure you're on a speaker view versus a gallery view. That could help as well. All right, so Camille and Diane, thank you so much for joining us, and we are all anxious to hear your program. Thank you.
Terrific, thank you. So I'm Camille Barron, and I have been in the Medicare business for over 10 years now, Medicare and health insurance, and I've been in the insurance business for over 30 years. And Diane Savastano is the president and founder of Healthassist. Diane founded the business back in 2004, and between the two of us, we actually have more than 25 years just in Medicare, let alone the other types of insurance, and Diane also has a very strong clinical background. So we, you know that expression, we know a thing or two because we've seen a thing or two. Well, that is definitely the case. I have bumps and bruises all over me because of it. But we are here just to try to have you make sense of all of this Medicare stuff. A lot of people come to us for help, and let me just put on my screen here. And I'm going to hit slideshow from beginning. There. A lot of people come to us because they're completely confused and overwhelmed when it's time to make that decision and it's time to go on to Medicare. I've had people say to me, I've been thrown to the wolves. I don't know what I'm going to do. And by the end of it, they're actually happier because they have coverage that really suits them the best. And they may not be paying as much as they've been paying. Sometimes they may be paying a little more, but they feel confident in their decisions because we've helped guide them through that process. And let's face it, health insurance is so important. in how we prepare for the future. So you may already be on Medicare, or maybe you're retiring or approaching age 65. Either way, our objective today is to share some of the basics about Medicare so you won't find it so daunting when the time comes. And what we hope you'll walk away with today is a framework that simplifies Medicare enough so you'll be equipped to make informed decisions about your health care. So to do that, we have a few things that we'll be covering during this time. Some of the topics will be things like, when is the right time to enroll in Medicare? What are some of the options and how much do they cost? How to make that right choice? And some of what we call ankle biters. These are important tips that if you don't know about them, literally could come out and bite you in the ankle, so to speak. So we try to make sure we cover all those bases for our clients. Before we start, the Medicare program is a federal health program for people who are 65 and older, and also people who are under 65 with disabilities, and also people who have end-stage renal disease. Now, the first question, when should I enroll? You know, with health insurance, and particularly Medicare, it's always, it depends. Never a straight answer. And so let's say that you are just turning 65 or going to be turning 65. You actually have a 7-month window when you can enroll in Medicare. And that begins 3 months before the month of your birthday, and then the month of your birthday, and then 3 months after the month of your birthday. So there's quite an extensive time there in which you can do that. And we recommend that people do it no later than the month of their birthday, unless they have already been covered and continue to be covered by their employer insurance, and they are actively employed. So those folks may not need to sign up for Medicare because the insurance that they have from their employer takes the place or covers the same types of things as Medicare covers. So they can postpone their enrollment. But when the time comes that they do decide to retire, then they need to sign up for Medicare, and they can do so during what's known as a special enrollment period. And that type of a enrollment period is an 8-month window. It begins on the month of your retirement, and actually it begins the month that your employment ends or your group health plan ends, whichever comes first. And then let's assume for some reason you didn't enroll in either the initial enrollment period or the special enrollment period, but then you remember, oh, I should have enrolled in Medicare. You can do so, but you have a limited time frame to do that. Beginning in January 1st through March 31st of every year, Medicare has what's known as a general enrollment period. And during that time, you may enroll in Medicare, and it will be effective in July of that same year. Now, keep in mind that you may have to pay penalties, late enrollment penalties, if you have gone more than a year beyond the date that you should have enrolled in Medicare, but it is still possible and you can still get into Medicare at that time. Now, people ask, well, how do I enroll? You enroll through the Social Security Administration. You can either do it online or on the phone. In the past, before we had the pandemic, it could be done in person, but no matter what, it's done through Social Security, and it's a relatively simple process. Now, for people who are already on Medicare, there is a time period at the end of each year called the annual open enrollment period. And that's when people who are on Medicare plans, whether it be a Medicare prescription drug plan or a Medicare Advantage plan, you have the opportunity to change plans. Let's say that you're on a Medicare prescription drug plan, and maybe you've started taking some expensive prescriptions during the year. Well, you know, there may be certain plans that you may be able to have coverage that is more cost effective for you, and we assist our clients in looking for those opportunities. So the next question is, okay, well then tell us, what is Medicare? What are all these parts of Medicare that I keep hearing about? So if you've been covered by an employer plan, you generally have one policy that covers your medical and prescription coverage. Now, when you go on to Medicare, those same things are covered, but in a different way. So instead of having a single policy, Medicare consists of three components. I like to think of them as a three-legged stool. The first leg of the stool is the government subsidized Medicare, Parts A and B. Part A is inpatient care. For most people who've contributed to the system, that comes at no cost. And then there's Part B, which is all of your outpatient care. And that includes doctor visits and includes outpatient surgery, includes testing, anything in which you don't have to stay overnight at the hospital. And there is a premium associated with that. The standard premium for this year is $144.60. Medicare itself, A and B, cover approximately 80% of our medical costs. It doesn't cover prescriptions because that's separate, but approximately 80%. And in the absence of any other coverage, we, as the insured, will have to pay that remaining 20%. For most people, it may not be a lot, but if you have a serious condition or you have a serious accident where your medical costs are extremely high, well, there's no cap on that 20%. So you are responsible for paying all of that. And that could get pretty pricey. So for that reason, Medicare offers Medicare Supplement plans, also known as Medigap plans. And that's the last thing on this list that we're looking at, the Medicare Supplement, also known as Medigap. And what those plans are designed to do is cover the remaining 20% to some extent. And the some extent depends on which Medigap coverage you have. And we will talk about that in a little bit. And then the third leg of the stool is the prescription drug coverage known as Part D. There are about 24 prescription drug plans available in each market. And the way that we find out which one is going to cover your prescriptions most cost effectively is we ask our clients to give us a list of the prescriptions they take on a regular basis. And then we plug those in to an analysis tool, and it spits out the different prescription drug plans and what the expected costs would be. That includes both premiums and out-of-pocket costs for prescriptions. So those three things combined, the Medicare Parts A and B, the Medicare Supplement, and the Part D, are the three legs of that three-legged stool. Now, in addition to that, or in place of that, we have what's known as Medicare Advantage plans. And I know that you see them on TV because they're advertising these all the time. This is known as Medicare Part C. And instead of having those three different components that we just talked about, the Medicare Advantage plans are actually a combination package that consists of all three of these, the Parts A and B, your medical coverage, and your prescription drug coverage. Some plans, some Medicare Advantage plans don't include prescription drug coverage. Most of them do, but we can always add on the prescription drug coverage if needed, if it doesn't include that. So there are standard costs for each of these components of Medicare. As I mentioned, the Part B standard premium is $144.60 per month this year. The Medigap plans in Massachusetts, we are looking at somewhere between $104 to $180 per month on average. And then the prescription drug plans run from about $13 to $128 per month. So those costs are what you could expect to spend on Medicare. And if you decide instead that you want a Medicare Advantage plan, those can range anywhere from zero premium all the way up to $266 per month. And remember, Medicare does not pay for long-term care. Some people think it does. The only time that Medicare pays for time in a nursing home is if you require rehab or skilled nursing after you've been in the hospital. But that is not long-term care. And unfortunately, it tends to be a very big gap today. And there are several ways you can cover it, one of which is insurance. But that's a little bit out of scope for what we're talking about today. Now, I mentioned the standard costs, and we just reviewed those. But depending on your income, you actually may be required to pay more. And before I explain that, let me just ask you to understand a couple of definitions. First of all, modified adjusted gross income. Now, you know that when you file your income tax return, you have the AGI, and that's what you pay taxes on. But for these purposes, Medicare also considers any tax exempt or tax deferred income when it calculates your income. And what they come up with for your modified adjusted gross income determines whether or not you are going to be subject to an IRMA, income-related monthly adjustment amount. And this is actually a surcharge that is added to your monthly premiums for Medicare Part D and Medicare Part B. So you don't pay just $144 a month for Part B, you pay more. Let me show you a table that shows how much you would pay. You see here, this is a table that shows on the left the modified adjusted gross income, whether you are an individual filer or a joint filer. And over to the right, it shows you what those IRMA surcharges would be. So let's say that your joint income tax, your joint AGI with the addition of the non-taxable income, you're somewhere in the range of $272,000 to $326,000. So in addition to your $144.60 per month for Part B, you are required to also pay an additional $231.40. So the total you pay is $376, not $144. If you're in the highest range, let's say you've earned more than $750,000, well, then you're going to be in the highest category. You would pay an additional $347, and your total would be $491.60 for Part B. In addition to that, there's also an IRMA for prescription drug coverage Medicare Part D, much less than the Part B. If you have earned less than $174,000 per year, you don't have a Part B and you don't have a Part D IRMA. But let's say you have earned between $174,000 and $218,000, then you add an additional $12.20 plus your insurance premium for Part D, and so on it goes. So the point is that you're not always just paying the standard premiums. And by the way, you see here, it says yearly income in 2018, and this is what you'd be paying in 2020. The reason for this is that the Social Security system, which is the one that calculates all of these, the IRMAs and the premiums, they go to the IRS database and they access your tax return, the most recent one that they have access to. And in the beginning of the year, beginning January of 2020, well, they didn't have your 2019 tax returns yet. So the latest one they had access to is 2018. So it really boils down to they look at your income tax return of 2 years ago to determine what your IRMA will be, if any, for the current year. So we often tell our clients, well, you know, doing well in life can be a blessing and a curse. And they say, well, this is definitely the curse. Okay, next question that people ask, what are the options? How do we piece together all of these different components that we just talked about? And again, there's never one simple answer. So you need to have Medicare Parts A and B if you are not working and you're retired, say. So you can have Medicare Parts A and B with Part D, a prescription drug plan. That means that you will not have any coverage for that gap that we just talked about, but you will have coverage for the 80% of the inpatient and outpatient costs, and you will have coverage for the prescriptions. The most comprehensive way to package this is if you have those three, you have Medicare Parts A and B, you also have prescription drug coverage, and you have a Medigap plan, because that means that your medical coverage and prescription drug coverage is there, and your Medigap covers you for some or mostly all of that 20% that Medicare Parts A and B don't pay. And then you have a Medicare Advantage plan in lieu of above, because remember, Medicare Advantage packages these things together. And in some cases, very few, but there are some Medicare Advantage plans that do not include prescriptions. So in that case, we would have a Medicare Part C, the Advantage plan, plus Medicare Part D. So, people want to know, well, which one of these, the Medicare Advantage or the Medicare Supplement with the prescription drug plan? And there again, there's not one right or wrong answer, but some of the differences between the two can often help people make a decision. So for instance, in terms of the coverage, Medigap plans are much more comprehensive. With the Medicare Advantage plans, there's more cost sharing. We kind of look at the Medicare Advantage plans as a pay-as-you-go system, where you pay generally a low premium, in some cases zero premium up front, but then as you use medical services, you pay co-pays or co-insurance. And in addition to that, there is a deductible in many of these plans. The comprehensive coverage of the Medigap, again, with these Medigap plans, you are covered for almost all of your additional 20% costs once Medicare pays its share. There are two different offerings in Massachusetts for Medigap. One of them is called the Medigap Plan 1A, and the other one is called the Core Supplement Plan. Those are very creative names, by the way. I can tell you think that. So the Medigap Plan 1A covers all of that remaining 20% of your Medicare, of your medical costs, with one exception, and that's a one-time deductible for Medicare Part B, which is $198. After you've met that deductible, the plan covers all other medical expenses, as long as the expenses themselves are covered by Medicare, and of course, as long as your provider accepts Medicare. The other plan is a little less generous. There is a deductible included for hospitalization. So that one, some people will take that plan and assume that they won't be hospitalized, and others might be cautious and they might say, I just want the more comprehensive one. In addition to that, another advantage of the Medicare Supplement is there are no networks, no provider networks. So you can have coverage countrywide. You can go to any provider anywhere in the country, and you don't have to worry about networks. And in some of the plans, you will have the same coverage if you travel abroad. And in comparison, the Medicare Advantage plans do have networks. You can either have an HMO, in which case you must stay in the network, or a PPO, where you can go outside the network, but you pay more when you do. And in addition to that, these Medicare Advantage plans have more administrative oversight. So there's less freedom than you would have in a Medigap plan. So those are the main differences between the two. And again, no right or wrong, it's just what suits you best. Okay, so people say, well, then how do I know? How do I know which one is the right one? And what we do with clients is we do a very deep dive into where they are now and what they expect to need and what their preferences are for their medical insurance. So, for instance, we like to consider the current plan that they have. We kind of use that as a baseline, right? We know what kind of plan they have, the level of satisfaction, what they've been paying for premiums, and what their out-of-pocket costs are. And we also look at if some of them have retiree medical benefits, either for themselves or themselves and their spouse. And then again, we want to be able to consider that as an option. So we want to know the type of plan it is and the cost of the plans. And keep in mind, when we say cost, we're not just looking at the premiums, we're looking for what you're going to be spending out of pocket as well. In addition to that, we look at, I'm sorry, I should have gone back one here, forgive me. We look at their health condition. We want to find out whether people have any medical conditions which require medical care, whether they have anticipated any surgeries or hospitalizations in the near future. And we also want to know all of the medications they take and how often they're taken and the dosage. And you know, with the medications, we can't really predict what we might be taking in the future. But we do know what we're taking now, and we can take a snapshot in time of that so that we can then input it into the system. The analysis is done, and we can at least say, based on what you're taking today, this is what you would expect to pay for your insurance and for the costs of your medication. We also ask about providers. We need to know who their primary care provider is and all of their specialists. We want to know whether they have a preferred hospital, if so, which one, and a preferred pharmacy, because all of these will also enter into the cost that they pay. And particularly the providers, if they choose the Medicare Advantage plan, they want to know if their providers are going to be in the network, and includes the hospital being in the network. That's very important. We also look at what we call utilization levels. In other words, how much do they utilize their medical insurance? Currently, now obviously if they have had medical conditions that they're managing, they probably have a pretty significant utilization level. Or maybe they don't right now, but they do have a condition that they're monitoring, and at some point they may need treatment. So we look at that. We look at travel plans. And the reason for that, again, is let's say that someone is going to retire and they want to have a secondary home someplace, Arizona, Texas, or Florida. If they want to live there several months of the year, and they want to have coverage that is more than just emergency coverage, because that would be covered anyway, but they want to be able to have their doctors there as well as their doctors at home. So that would suggest, if somebody wants that, that would suggest a Medicare supplement, because they won't be restricted like they would with a Medicare Advantage to just the network that they're on. People tend to utilize preventive care. We want to know how much of that they're using. Do they see, the annual primary care provider? Do they see the doctor for women, OBGYN? Do they see a dermatologist once a year, et cetera, et cetera? Because that, of course, is important. It helps at least to manage their health while it's still pretty good. Then we look at their preferences, and those preferences might be whether they want freedom of choice, networks or not, without administrative barriers, or will they be able to tolerate administrative barriers. Simplicity, the simplicity that goes with the Medigap plans versus the simplicity, the less simplicity, so to speak, that goes with the Medicare Advantage, because you have these administrative barriers. And also risk tolerance. We'll see an example in a little bit, but a lot of times these decisions on whether to have the most comprehensive coverage or less really depends on how much of a risk they're willing to take. If they're in good health now, are they willing to take the risk that they'll sign up for a Medicare Advantage plan or sign up for the core supplement, knowing that if something happens, they could be spending a lot more than they think. Some people say, I'm willing to take the chance. And other people say, you know what? I don't want to take the chance. Even though I'm healthy, I rather know that I have the coverage if I in fact need it. And then lastly, a lot of people who are turning 65, they may be married to someone who's not 65 yet, and they've been on the soon-to-be retirees company plan, and they need to have coverage. Well, are they going to be able to stay on the employer coverage? Should they go on COBRA? Or should we look at an individual plan in the open market for them? And we help them make those decisions as well. Other considerations that might impact costs or coverage. Again, the amount of prescription drugs you take is very important. And if you take a lot of brand name prescriptions, that could put you in what's known as the coverage gap, also known as the donut hole. And when you're in that period of time, you pay more for your insurance. I mean, you pay more for your prescriptions. So for people who are in that coverage gap, they just have to expect to pay more if they're taking the brand names, and we factor that in to their estimated costs. Again, are there deductibles in your plan? Are there co-pays or co-insurance? And again, provider participation in the plan. If you have a choice to go outside the network, how much more will it cost? And aside from the medical and prescription plan, some people have had dental and vision coverage through their employer, and they would like to continue having that coverage. So we often suggest to them that they first find out if they can go on to the employer's COBRA dental and vision plans. And if not, then we will find individual dental and vision plans for them. As I said before, long-term care, we just need to factor that in and make sure that people have some sort of a plan. It doesn't have to be insurance, but they are at least considering it. And then at the end of the year, coming up in October, we're also looking at changes that are coming up for 2021, and we have to superimpose that on what people have now to make sure that they are still making the right choices. Now I want to show you the outcome, the output that happens with the work that we do. I'm going to just make a change here. Let's see. Okay, can you see the whole screen here? If you can, I hope you can, because I'm having trouble with my my Zoom screen. But if you put it on speaker only, I think you'll have a better view. What this is showing us is we've gone through the whole exercise with people, with someone who has signed up for Medicare or will be signing up for Medicare Parts A and B. They are not going to have an IRMA because their income was lower than that threshold we talked about. So this person decided they would like to sign up for the Medicare Supplement 1A insurance. And Blue Cross Blue Shield of Massachusetts has a pretty good deal with these supplements. By the way, all of the Medicare supplements are the same. There's no difference because they are standardized, but the pricing can be different from one company to another. And with Blue Cross of Massachusetts, you actually have a 15% discount for the Medicare supplement in the first year. That discount goes down a little bit each year until the fourth year when you're paying the full price. So this person is signing up for the Medicare Supplement 1A, which is known as the MedX Sapphire plan in Blue Cross Blue Shield of Massachusetts. We also ran the prescriptions into the tool that we use, and we found that the Mutual of Omaha RX Value Plan turned out to be the most cost effective for them. That has a monthly premium of $24.10. And the amount that they would expect to pay for their prescriptions, if you look down at the last line there, $59. That's roughly what they would expect to spend on their prescriptions. And then the line above that last one, Medicare Part B has a one-time $198 deductible. So we show that as a yearly cost in the out-of-pocket expenses for healthcare. So when we factor all of these things in, this individual is looking to spend approximately $4,700 a year for all of their insurance, whether it be the premium costs and the cost out of pocket for their medical and prescription drug needs. Now, we often help people to make decisions. For instance, we have people who are thinking about retiring, but they're concerned about how much their health care is going to cost them when they do. So we have an example here of this couple who are looking to make that decision. This couple, one of them is working full-time and has coverage through the employer. They both have coverage through the employer, but they're not sure whether he should retire or stay on the plan, and their decision rests largely with the cost of their medical care. So we did a comparison to help them decide. We looked at the cost of the Medicare, we looked at the cost of the prescription drugs, we looked at the supplement plans, and all in all, it turns out that if this couple switched to a Medicare-based plans, they would be looking to spend more than $13,000 a year for all of their expenses. And then we compared that to what they would expect to pay for their current plan. In other words, if he continued to work for a while longer, and look how much less it is, $8,200 a year instead of $13,000. So he decided to continue working for a while and defer the higher costs of insurance and healthcare at a future time to be determined. It was important, though, that we were able to quantify these differences so he could see clearly how each of these options would impact him and his wife financially. Then we also have cases where we've presented all the options and someone may not be sure what they want to do. Now, this is an example here of an individual who's in pretty good health. So we looked at the cost of the most comprehensive package, the Medicare Supplement 1A, and the prescription drug plans that go along with it, and even COBRA for dental and vision. And all things considered, we see the bottom line here would cost her about $5,800 for the year. Over to the right, where we have the MedX Core Supplement, we have the difference in cost is about $4,300 per year. I can't see, I think it says 4,300. I can't fully see the screen.
It says 4,900 versus
4,900.
58, right?
Thank you. And so she's saving not quite $1,000, but that is an option because that core supplement also includes a Part A deductible. So if they're hospitalized, the costs for them could go up significantly than what this estimate shows. And then on the lower left, we looked at what it would cost to have a Medicare Advantage plan. Again, this individual's in good health, so she may want to consider that and just say, you know what, I'll just go with the Medicare Advantage for now. And the cost of that, when you consider everything, isn't that much different than it is for the Medigap Plan 1A. And in addition to that, there's also a retiree health plan. And we looked at what that would cost, and that turned out to be much more expensive, over $9,000 a year. So all of these factors that we asked her in the beginning, the cost is important, of course, but risk tolerance is important. And some of these other things, whether she thinks she'll be traveling and living someplace else for the year or part of the year. So because of that, and because her risk tolerance was low, she was one of those folks, and I happen to be one of them too, where I rather have the most comprehensive coverage, even though I probably won't use it now, but if I do, I want to know it's there. So these examples are really just there to show you how we help people make the right decision. Now, we also give our clients some important tips. And what I mean by that is that this is a transition for them. They're going from, in most cases, they're going from a company-sponsored group health insurance plan to a Medicare-based plan. And there's a lot of moving pieces when you make transitions. So having been there and done that for a very long time, both Diane and I, we have learned a lot of lessons. And we do share these lessons with our clients, because if we don't, they could get into a very bad situation that would either cost them a lot of money or just be very inconvenient. So here are some of the tips that we share with our clients. First of all, enroll in Medicare at the right time, and particularly enroll in Part B. Now, if you're still actively working and you're turning 65, then you may not need Part B, because the creditable coverage that Medicare looks for with Parts A and B, well, it's already covered by your employer plan. So why spend the money now if you don't need it? However, if you retire, you need to be in Part B. And why is that? It's because when you are no longer actively working, Medicare becomes primary. Up until then, when you were working, your company-sponsored plan was primary. If you had Part B, fine, that would be secondary. It would pay for some of that 20%. But when you're retired, you have to have Part B, because Medicare becomes primary. And any other insurance, such as a Medicare Supplement, would be secondary. And you know, if someone's on COBRA and they're retired and they don't have Medicare, there again, COBRA is not considered primary insurance once you're retired. So the key is whether you're working or not. That determines when you should enroll in Part B. And by the way, if you're contributing to a health savings account, when you go on Medicare, you can no longer contribute to it. And that's one of the reasons, honestly, why people defer signing up for Medicare, because they are contributing and they want to contribute as much as they can. The reason for that is that health savings accounts are designed to be paired with high deductible plans. Obviously, they're going to fund the health savings account to help pay for their costs. But Medicare doesn't have high deductible plans. Medicare is not something that would qualify as a plan that would be eligible for a health savings account. So we often ask our clients, if they want to continue to contribute and they're still working, it's okay to defer enrolling in Medicare. However, they can withdraw the funds from their health savings account after they're on Medicare. It's just that they can't contribute anymore to them. We also remind our clients, if they have spouses or dependents who are also insured under their plan, and do we need to make provisions for them? We look at COBRA, we look at other options so that they're well taken care of as well. And of course, we conduct the analysis that we talked about, their utilization of healthcare, the prescriptions they take regularly, and their risk tolerance, and reminding them again that it's all costs, not just the premium. In addition, we have these, what we call ankle biters. The IRMAs, that we need to know ahead of time what they can expect to pay, because if we don't, they could be surprised. I'll never forget when I first started working in Medicare, this was years ago, and I wasn't yet familiar with the IRMAs, but my role was to really help this client sign up for the Medicare plans, the supplement plans and the prescription drug plans. And come a few months later, this person got back to us and they said, why didn't you tell me I was going to have to pay an additional $300? And I said, oops. So my manager actually called the client and explained. But we know these IRMAs can be a burden for some people, so we do let them know. And a lot of times they can speak with their financial advisor if they have one, because sometimes the advisor can advise them to make some financial moves that could help minimize these IRMAs. It's important that they also show their providers their Medicare card and the insurance ID cards once they are on Medicare. The providers need to know that their Medicare is primary insurance and the Medicare Supplement is secondary, or if they're on a Medicare Advantage, then that's the insurance. The reason we do that is because sometimes the providers are not aware that the insurance has changed. So when the person goes to the doctor's office bills the previous insurance company, the group plan, and then the client gets a bill for the services that they've got. And what we find out is that the provider billed the wrong insurance. And so we have to get involved and get in touch with Medicare to make sure that they have it in their system, that Medicare is now their insurance and the supplement is secondary. We have to, in some cases, call all of their providers and let them know that. We had a case, it was maybe 2 years ago, where this individual had many high expenses, and he got billed quite a bit, but we had to get in touch with these providers now and have them reverse those bills and rebill Medicare. And that wasn't fun. I mean, it didn't end up costing him as much once it was all said and done, but it took a lot of time. And we also advise people to, even though they know that their company is going to cancel their group plan at the right time, we always like to be sure. And so we ask them to call their prior insurance carrier and say, have you received notice? Please make sure that that insurance is canceled. And for those who already are on Medicare, every year we send out an invitation to them to revisit their selections from the previous year. And mostly it's the prescription drug plans, because the Medicare supplements remain pretty static from year to year. But the prescription drug plans change. First of all, your prescriptions might have changed. Secondly, even if they haven't, the prescription drug coverage with your current plan may have changed. It may cost more because the formularies have changed. So what we do is, we for those who choose to participate, we do another analysis of their prescriptions, and we input it into the Medicare system for the upcoming year. And it tells us whether or not the plan that they're still in is still the most cost effective, or whether it would make sense to go to a different plan. Now, this starts on October 15th of every year. And I remember this so much every year that this is the only thing I think about when October 15th comes. And that got me in a little trouble for a few years, because my anniversary also happens to be on October 15th. And I'll remember last year, I realized it's October 15th, and I went into the kitchen where my husband was, and I said, you know, today is October 15th. And he says, that sounds familiar. Is that when we got married? And I said, yes, that's our anniversary. So ever since then, he doesn't let me to forget the fact that it's okay if he forgets, because I forget every year. So in addition to that annual enrollment, again, just make sure that the providers know Medicare is primary, and that you planned for the gaps in coverage, which include the fact that Medicare doesn't cover long-term care. Okay, so we've given you some information here, but there are many other resources available to you. Medicare itself has a lot of useful information, either by calling them or they have a website. The annual Medicare and You booklet comes out, and if you're approaching age 65, you probably will get one. If you're already on Medicare, you either will get one or you have it already. And then Social Security, which really is the gate into Medicare. That's where you first enroll. There's a lot of information on the Social Security website. There's a Social Security section of their website that just talks about those IRMAs and explains how they work. And then there's also the Shine Counselors. Now, if you live in Massachusetts, the Shine Counselors are individuals who volunteer, and what they do is they give you assistance in signing up for Medicare, changing Medicare. They do a really good job of helping people decide what they should do either for the first time they're enrolling or during the annual enrollment period. Every state has one of these services. They're just called different things. And in Massachusetts, they're called Serving the Health Insurance Needs of Everyone. What they don't do, of course, is the detailed fact-finding and the detailed analysis that we do, and also those cost comparisons and guidance through the whole process from beginning to end, including through the transition where those ankle biters could arise. But they're still a very good resource. So to summarize, the key points: Medicare requires consumers to be active, informed participants. And you need to understand all of these different factors and know what your preferences are, because no one else can make that decision for you. And you need to decide when the right time is for you to enroll, conduct an analysis based on your specific utilization of healthcare and prescription drugs, and remember to consider all costs when planning, not just the premiums. And if you're already on Medicare, it's important to reassess this every year, because things could change and turn out to be much more costly. So we'll now take some time for questions. And Suzanne, I'm going to turn it back to you.
Okay. Thank you, Camille. That was very informative. And I really appreciate your time and the effort that you've put into this to help us learn about this complicated topic. We have a couple of questions that attendees have posted, and then I had a couple of questions.
Okay.
Somebody asked about the vision and the dental. This question actually got posted right before you had talked a little bit about that. Mm-hmm. I noted that you had an example where there was Cobra Dental and the cost was about $50 a month, and the vision plan was about $8 a month or so. And that appeared to be from a prior employer. Is vision and dental independent of a prior employer something that you could help people with?
Oh, sure, absolutely. What we find, though, unlike the medical coverage, where Cobra might not be the most cost effective, especially if you're on Medicare, with dental and vision, we have found in most cases that the Cobra option is less expensive.
Okay.
And most people, if they go on Cobra, they can stay on it for 18 months. In a few cases, they can stay on it longer.
Okay.
So we often will encourage our clients to go with the Cobra, and then when the time comes, we'll look for an individual and family plan in the open market.
Good.
So, Suzanne, I just wanted to expand on that a little bit. So traditionally, dental and vision is not included in traditional Medicare. So that's why we look at Cobra options, or we look at options to purchase those plans on the open market if you go the route of A, B, Supplement, and D. Some of the Medicare Advantage plans do include some dental benefits and vision benefits. Not all of them, and they might include some of those benefits at varying types of cost levels, or I should say coverage levels. So the reason I bring this up is because these dental and vision benefits associated with Medicare Advantage plans are being very highly marketed. You'll see them advertised all over the place. And, you know, so they're alluring to a lot of people. They're like, oh, I'll get dental and vision. What you have to be concerned about is that those costs and whatever the coverage level is that the Medicare Advantage plan provides tend to not be your high ticket items. So sometimes if someone's a really heavy utilizer of the healthcare system and they might be hospitalized, it might really behoove them to be on a Medicare supplement plan and pay out of pocket for their dental and vision, because those are not the high cost items as opposed to if you were hospitalized. So that's where some of the analysis comes in.
Understood. Thank you.
Mm-hmm.
And then we had a question about, can you change from a Medicare Advantage plan to a Medicare Supplemental plan? And what are the logistics involved in doing that?
Sure. We get asked that question quite a bit. So in most states, you have 1 year, if you're on a Medicare Advantage plan, you have 1 year in which you can change to a Medicare Supplement plan. But other than that, in most states, you have, when you sign up for a Medicare plan, if you sign up during that initial enrollment period, you have what's known as a guaranteed issue status. And what that means is that you will not have to answer health questions. They don't ask you about your medical history. But then after that 8-month window passes, 7-month window, you will be asked health questions if you try to enroll at some point in the future, to switch from the Medicare Advantage to the supplement plan. So in that case, you could apply, but if you have had a health condition maybe, or something that could be an issue, you might either not be able to be approved, or you could, but at a higher cost. That's the case in about 47 states. Now, Massachusetts, though, happens to be one of the 3 states that has a permanent guaranteed issue status. So that means that you can change to a Medicare supplement most of the time. And when I say most of the time, you asked the question about the Medicare Advantage. If you have a Medicare Advantage, you have to stay on that until the end of the year. And you could disenroll from the Medicare Advantage between October 15th and December 7th in the annual Medicare open enrollment period. And you could sign up for a Medicare supplement beginning in January. If you are already on a Medicare supplement, but let's say you chose the lesser of the two, the core plan, and you've decided that you want more comprehensive coverage, you could sign up anytime during the year. You don't have to wait for the annual enrollment. Now, I actually have a friend whose husband was going to have surgery. And she said, well, I have the core plan. And I said, well, when is he going to have the surgery? And she said, it was a month or 2 beyond the month that we were in. And I said, well, you can change it to the supplement 1A. Are you serious? She said. And I said, yes, in Massachusetts, you can do that. So in Massachusetts and 2 other states, I think it's Connecticut and New York, you can. But other than that, I always tell people to consider the Medicare supplement decision a permanent one, a long-term decision. The prescription drugs you can change every year, but they really need to think carefully if they're not in one of those states that has permanent guaranteed issue. They really need to consider the future and not just now.
There are exceptions to all these rules, Suzanne, you know, we say this all the time. So one little exception to that is if you happen to move. So if you were living in, say, Florida, I think about this with my parents, because if they ever move back to Rhode Island, I'm definitely going to put them in a supplement plan, because years ago they chose a Medicare Advantage plan without consulting me. And I would say it has not served them as well as a Medicare supplement plan would have. In the event that they move back to Rhode Island or Massachusetts, we have an opportunity when people move, you're guaranteed issue again for a period of time. So it's just a little exception, little idiosyncrasy to all of this. So I plan to change them if they move back.
And actually, there's another exception. In California, the month of your birthday, you can make a change. to a different plan.
Every year?
Yes.
Okay.
Okay, so, maybe move to California.
We have another question. So this person, her spouse recently passed away, and she's asking, when they look back 2 years at the tax return, will there be some consideration that the marital status has changed and therefore there's been a change in an income? And I guess I would couple that with a question that I get sometimes from clients who sell their property and they then have a lot of income in that 1 year when their house is sold. And so 2 years down the road, they get whacked with a big increase. So in either of those cases, in this person's case, could she appeal that to say my income isn't that anymore? Or, is that the way it is?
Sure. The way it works is the Social Security system looks at the income every year. So for 2021, they're going to look at the 2019, 2022, they'll look at the 2020. So the IRMA will go up and down depending on that. But if somebody is sure that their income has changed significantly this year as opposed to 2 years ago, yes, there is a form. You can request reconsideration. We show our clients how to do that, and they can do it. It's not a big deal.
Is it usually successful?
Yes, it has. It has been, because they have to produce the right documentation, of course. But if they do that, then yes, every time we've known, it's been successful.
Okay, good to know. I was wondering, Camille, one of the things you said is that the Medicare Supplement plans are all standard, but the cost varies. So when you say they're all standard, you mean they all offer the same benefits, but yet you could pay more from one than the other?
From one company to another, yes.
So why would you ever pay more?
Well, I had, when I was working before, it was a different job. This was another state, it wasn't Massachusetts. Florida, for instance. Florida, the United Healthcare AARP plan is most often the one that people pick, and it is quite competitive. So when I suggested that to one of the clients I was speaking to, I said, the United Healthcare AARP plan will be your best deal. No, I don't want anything to do with AARP. I will not have anything to do with it. So we found on the Blue Cross plan instead. But other than that, really, it's preference. It's either something you don't want or a company that you like because you may have already been with them.
Yeah, in Massachusetts, the three major players, although there are 10 companies that offer these same plans, the three major players are Blue Cross, Harvard Pilgrim, and Tufts. And Blue Cross is about $20 a month less than the other two plans. And the other two plans vary by a few dollars. And so we often joke and say, you'd rather go out for a coffee once a month because maybe lunch, an inexpensive lunch, and pay because the plans are exactly the same. So I think it has to do too with how large these particular companies are and how many participants they have and how much risk they're spreading. But so they're all the same in a particular state. It's still all sort of driven by region or zip code. So to give you an example, so that Medicare Sapphire plan that Camille was describing, here in Massachusetts it costs about $170 a month. It's called Plan G in another state. And in Florida, again, due to, I believe, the population and the risk, that same plan costs about almost $300 a month. So, and it's all driven by zip code. So you have to look at the plans that you're eligible for by zip code, but there are regional differences in the cost of those same exact plans.
Got it. And that sort of goes to a question that somebody else asked about, the cost of premiums in other states, and some of them being less than Sapphire. But as you mentioned, in Florida, for example, it could be more. Mm-hmm. I know one thing that people will be interested in is tell us a little bit about how you would charge for your services and what people would expect to pay for that.
Diane, I'm going to let you handle that. Diane is the founder and president of Healthassist, so I'm going
Sure.
to hand it off to you.
Yeah, sure. So our process is generally when people are interested in working with us, they usually call me and I talk to them and gather a little bit of information to understand and frame the discussion about what it is that they're doing. You know, whether they're retiring, whether they have a spouse we have to consider, that sort of thing. And we have a standard process we go through in terms of these projects where we have a letter of agreement that clients sign, and then we send out a very detailed list of questions that we have them answer. And in preparation for our first meeting, we generally conduct some analysis. Even in advance of that first meeting, we share one of those spreadsheets that Camille shared, and we walk through all of the elements and the components. We charge by the hour. We charge $200 an hour for our services. These projects vary tremendously depending on circumstances. You know, if it's one individual and it's really simple and they're finally retiring and we've got to get them on part B and then we've got to do the other components, you know, it could be 3 hours. If we're talking to a couple and we've got all these complexities, because maybe, you know, one is retiring, one isn't 65 yet, maybe we still have dependent children we have to consider. We've even had dependent grandchildren. Maybe we've got a retiree medical plan that we have to even talk to the HR people about. Well, that could be around 10 hours. So, you know, when I'm listening to someone's story, I'm kind of predicting in advance generally how many hours it might take to complete these projects. And we usually have clients send a retainer in advance, and we either return the retainer if they haven't used all the hours, or we will bill them beyond the cost of the retainer if we've exceeded it. So, and then every year we reach out during open enrollment season to see if they want us to reassess. So that's our process.
Okay, thank you.
Mm-hmm.
I think we've answered all of our questions, and let me just double check on that. I just want to mention you stressed a couple of times, Camille, that long-term care costs are not covered by Medicare, either the supplemental plan or the other type of plan. And for our clients and people who work with us, you know, that's one of the things that we will talk to clients about. The way to pay for long-term care is private pay, meaning that you're just writing a check for the cost of your care, which, as everybody knows, can be very expensive. You know, here in Massachusetts, that's anywhere from $13,000, $14,000, $17,000 a month. Long-term care insurance is a terrific option if you're eligible and it's affordable for you, keeping in mind that there's lots of different plans available that you can structure to meet your needs. And of course, if the other way to pay is through Medicaid, called Mass Health in Massachusetts, and you can do some planning to cause you to be eligible for Medicaid in the future by maybe using irrevocable trusts or other types of planning, or something happens suddenly and you're facing long-term care. You should definitely give us a call to see what options are available to you. We've done Smart Counsel programs in the past on long-term care, paying for long-term care, and we probably would do those again in the future. But for now, I want to say thank you to Camille and Diane. If you would like to reach out to them with help with picking a Medicare plan, Camille's information is there on the screen. We'll also post this webinar to our website, so you'll be able to access it there. And if you have any trouble finding that, then, you know, please call the office. I think it will take a couple of days to convert that and post it to the website. And of course, it's all contingent on the fact that I did that correctly and it got recorded. So it'll be a surprise. Anyway, thank you everyone for attending. We really appreciate it. We look forward to seeing everyone in person again. But until that happens, you know, be well, stay safe, and take care. Night now.
Thank you, Suzanne. Bye-bye.
Welcome.
Thank you.